So we are in a very fortunate position now with CLL that we have two classes of drugs that are extremely efficacious. On the one hand, we have Venetoclax-based therapies, and typically in treatment-naive CLL, we would use Venetoclax and obinutuzumab as time-limited therapy for 12 months. On the other hand, we have the BTK inhibitors, of which there are a number of BTK inhibitors that are registered and available in multiple jurisdictions. BTK inhibitors are typically given continuously as oral tablets for the long term until patients develop side effects or intolerable or develop progressive disease. The choice between Venetoclax-based therapies and BTK inhibitors, in my practice at least, is a discussion with the patient. And it's a discussion with the patients about their values and what they want. Some patients are very keen to have time-limited therapy, and my counselling for them is that the best time to achieve a durable period of treatment time off treatment is in the upfront setting. For those sorts of patients, Venetoclax-based therapies are very attractive. Other patients really value not having to do the tumour lysis ramp-up that comes with Venetoclax initiation. And for those patients, using a BTK inhibitor, which is much easier to onboard, is often the best choice. Of course, patient comorbidities are important here, and patients with cardiac disease or other reasons to bleed, I might steer away from the BTK inhibitors in favour of Venetoclax. On the other hand, patients with renal impairment or difficult to control fluid status, I might steer away from Venetoclax because of the challenges with onboarding and tumour lysis syndrome. Similarly, patients with very bulky disease, you might prefer to go with a BTK inhibitor because of less risk of tumour lysis syndrome. I also take into consideration the patient's genetic profile. As yet, we don't have good data to guide genetically informed decisions in this space, but it does help me to think in terms of future planning where we might like to consider treatments such as allograft or CAR T cells.